And with BPPV, if it's in the horizontal canal, it just depends on which side it's on. But typically all you have to do is just slowly roll over. Because the idea with BPPV, for those that don't know, is that there's crystals that have been dislodged. So inside your inner ear, there's a little house called the utricle. And inside there's crystals called little otoliths, and then you have your canals that come off of that. Now, what happens in BPPV is a little crystal gets dislodged out of that, and it ends up somewhere in the canal. And so when you move in a particular position, usually it's people will roll over in bed, and the crystal will come down, and it will create this negative fluid wave, which will stimulate the hair cells and give you the sensation that you're constantly moving. So you'll feel like you're spinning. The whole world, your eyes will even show it. Your eyes will be flicking back and forth trying to catch the room, because your vestibular system is telling your brain that you're spinning. So your eyes are trying to figure out what's going on, and so they're moving all over the place. So it gives you the sensation that the entire room is spinning around you. So BPPV stands for benign, meaning because there's no, it's not like a bad thing. It's not harmful to you in any way. It's benign. It's paroxysmal and proximal or positional vertigo. So it's a positional thing that happens for a short period of time, and it's benign. And so when you roll over, the crystal stimulates the fluid stimulates the little hair cells, gives you the sensation you're constantly moving. The whole thing you have to do is just turn in a certain position and in a gradual way. And if it's horizontal canal, there's a thing called the barbecue roll, which you essentially you start on your side, you roll onto your, is it on your back first, then onto your other side, then onto your stomach, then onto the side you started on. And in doing that, you're moving the crystal around the canal and back into the utricle. So literally in one treatment, it's got like a 90% effectiveness rate. So whoever diagnosed you with horizontal canal BPPV should have been able to fix you that day. If not, maybe the second or third visit. It's very, very treatable, very, very easy, but it is scary. So if you're worried about it, don't worry about it. You just got to find somebody that can kind of guide you along how to do that. But even if you go to YouTube, there's probably some stuff on how to do it. The only problem is you got to figure out where it is, and depending on the nystagmus that you're having, which is the eye movement and the direction of it, that will dictate where you start and how you do it. So that's the only thing I can't really help you with.